I'm going to talk today about rebalancing services to better support children and families. My name is Jen MacBlane, and I work for Public Consulting Group. We are a national consulting firm that does management consulting across the nation. I am also the mom of 2 teens through adoption and a member of a community that is struggling to meet the behavioral health needs of young people, probably like many of you in this room. At PCG, I have the honor of helping states develop systems of care for children and families. And part of that work is developing rates. Over the past 20 years, we've seen a real push toward higher quality residential services, short-term stays, with things like high staff-to-child ratios, family engagement services, transition support, evidence-based practices, all of those things. And it costs a lot. When I first started doing this rate-setting work, or even 10 years ago, residential rates were in the $100 to maybe $300 a day range, and now they're $200 to $1,000 a day or more. And that is what high-quality, facility-based services cost. Nationally, we're spending almost $4 billion on residential care for children. And we know that challenges still remain. We have workforce shortages and underpaid staff, children and young people placed far from their homes, and mixed experiences. And I'll just let this young person speak for themselves about their experience. So, we know that we have rapidly rising costs, mixed experiences, limited outcome evaluations and research. And so I ask, is this path sustainable? Research tells us that resilience in young people is fostered by close connections with caring adults and supportive communities. Research also tells us that collaboration-oriented practices, relationship-oriented practices, and empowerment-oriented practices are effective in treating young people with complex needs. So what if we dreamed bigger? What could we do with $300, $500, even $800 a day to keep families together, even families with young people with complex needs? I can imagine intensive in-home support services where we pay caretakers to provide full-time or part-time care. Why can't we pay grandparents, aunts, and uncles to provide care in the home and support in the home? I can imagine self-directed services where we give families a budget and let them choose their own services, pay their own, hire their own providers, and pay them, just like we do in home and community-based services. I can imagine much more robust mobile response and stabilization services where we train people throughout the community to provide mobile response, just like we train volunteer firefighters, so that even in rural areas, someone can respond. This is a group of young people trained by Public Works Alliance in California, young people exiting state systems who are now trained to be emergency medical service providers. I can imagine enhanced respite and foster care where we pay for people to have homes, beds in their homes on demand when families need them, just like we pay for emergency shelters to have beds available whether there's somebody in them or not. Families who use respite services feel very supported. And we know that in-home services, respite services, mobile response services are effective elements of a system of care. So what can we do to take those services to the next level? We're spending nearly $10 billion a year on out-of-home care for children and families. So my call to action for all of us is to think bigger, think more creatively. What could we do to keep more families at home? Try new things, see if it works, reinvest, and repeat. Thank you.